Good evening. Please join me in the invocation. On behalf of all here and all the faiths and beliefs present, we celebrate the hard work and dedication of these brand new practical nursing and medical assisting graduates as they begin their careers in the service of their fellows. We rejoice in the knowledge that they will be true angels of mercy in our community. We are thankful for all that has been given us, and we ask that these graduates be given strength as they give their all to others, especially in these troubled times. Amen.
Almost say it again. Good evening. Come on, y'all do better than that. Good evening. There you go. That's better. Well, on behalf of the Board of Trustees, the faculty and staff of Nash Community College, I want to welcome you first to campus, and then also welcome you to the Medical Assisting and Practical Nurse Penny. My name is Hunnicutt, and I have the honor of being the 5th president of this incredible institution. Medical assisting and practical nurse graduates are in high demand across the country and certainly in our area. So graduates, you chose your profession well. To each of you being pinned tonight, I offer my congratulations and I applaud your efforts. Thank you for allowing Nash Community College to be a part of your life. And remember, once you become a Nash Community College Nighthawk, you're one forever. So you cannot get away from us very easily. There is another group of folks here tonight that need congratulated and our gratitude. And that is everyone in attendance who has supported you and will continue to support you no matter what it is you need during the rest of your life. To the family members and friends of the graduates here tonight, I say thank you. So what do you think, graduates? Shouldn't we give them a round of applause? Again, congratulations for your accomplishment tonight. I wish you the very best in all of your future endeavors, and please reach out to Nash Community College anytime we can be of assistance. Thank you.
Good evening, everyone. My name is Olivia Edwards, and I would like to start by thanking my instructors, Ms. Jenkins, Ms. Trace, and Ms. Lawson, for giving me this opportunity to speak, and thanks for everyone that came out tonight in support of me and my fellow classmates. If you know me, then you know I never thought I'd be standing up here in front of everyone giving a speech. I'm a little nervous, so bear with me. But my instructors gave me the courage I needed, and I'm so proud of myself and my classmates I had to say something. I was asked to talk about my experience in the practical nursing program. When I first started this program in August, I had just graduated high school and had gotten the nursing program early. I thought I was something, let me tell you. I thought I was all big and mighty. I learned pretty quickly I was not. I never really listened to people when they said nursing school was hard, but they were right. You can ask all my fellow students and they will tell you that I think every one of us has had several breakdowns throughout this year. Just ask my mom, she knows. But we got through it as a class, and yes, it was hard, but that is what nursing is. You have hardships and difficulties that you will face while in the healthcare, but this program has taught me about determination and has given me the confidence I needed. As I started thinking about how me and my class have made it through this year, I remember how at the beginning of school, when the teachers asked us why we wanted to become nurses, everyone said the same thing: I want to help people. People realize how important nursing is, but some people don't realize that it's more than just giving medication or starting an IV that can save someone's life. It's walking into someone's room with a bright smile and being there to listen to them that can save someone's life. I have seen that firsthand during this program. As we stand here today graduating and we go off into our different career paths and jobs, it's sometimes easy to get caught up in the money or the job title. If I take this job, I can make this. If I go to school, I can become this and make this. But don't ever lose sight of what made you want to become a nurse in the first place. But also don't let anyone ever put you down, because we made it through, we did it. I wish the best to each one of you. I know you will all become great nurses, because this year we have all shown great determination, focus, intelligence, but I've also seen the compassion and sympathy from everyone, and I know that we're all going to make a great impact. And to quote one of the RNs at our clinical once told me, "Y'all survived through COVID, y'all can do anything." I want to thank my instructors again for trying their best during this roller coaster of a year. Through online and dealing with all the COVID stipulations, you got us through, and I can't thank you enough. As well as to all the parents, siblings, spouses, children, family, and friends out there tonight for being our support people to catch us when we fall, to encourage us when we thought we couldn't do it anymore or we wanted to quit. You all believed in us and knew that one day you'd be sitting right here watching us as we get ready to cross this stage. Again, I'm so proud of everyone here. Thank you.
Hi, good evening. My name is Susan Bell. A year ago, we started this journey today, and we are ending it not just as classmates, but as family. So what is a medical assistant? Some say medical assistants are the heart of the healthcare. That really didn't hit me until I began my clinical experience, that I would realize how true that statement really was. Medical assistants are the glue that holds the entire healthcare process together. Medical assistants work not only in office settings, specialty practices, labs, hospitals, long-term healthcare facilities, hospice, and even in homes. We usually are the first and last face that person sees when receiving treatment. Therefore, that's the responsibility of holding a professional image. Medical assistants are trained in so many things like EKGs, giving medications, organizing charts, assisting providers with medical procedures, taking vitals, filling out insurance forms, and the list could go on for hours. But in reality, there are some things that we just can't train for. Not only is the medical assistant a healthcare professional, but also a listener, a comforter, an educator, and advocate. We are able to welcome an anxious patient. We are able to recognize the correct blood pressure. We are able to obtain a throat culture, administer an injection, and intervene in any emergency situation. We are now trained and ready to give a really big impact on the health of our community and what that accomplishment that is to us. Just think about what we learned this past year. We have learned more than just what we wanted to, especially like billing and coding. However, HIPAA, EMR, OSHA, EKG, SOAP, CDS, PRN, PPE, MDS, DS, all mean something now to each of us. 2020 was difficult. In the blink of an eye, so much changed due to coronavirus and discrimination of all kinds in our country, especially those that have affected sitting here today. Our homes became our classrooms, face masks became an everyday accessory for us, and we adjusted to the new normal. But we all remained dedicated. I know our circumstances weren't ideal and somewhat disappointing. Fall semester started off slow, and for our class, we didn't come together as one. You were either a Tuesday class or a Thursday class. Our exam process became torturous. Proctor track became everyone's worst nightmare. We didn't get as much in-person class time, and we had to endure temperature checks, COVID questioning, even to enter our classroom. Our academic journey has been filled with laughter, sometimes tears, with friends that we made along the way. It was a journey filled with late night studying, coffee-filled mornings, afternoons, and evenings. We spent countless hours completing online assignments, stimulation practices, learning medical terminology, understanding medical abbreviations, researching etology, completing pathology projects, memorizing order of withdrawals, ins and outs of pharmacology, charting patients' information, understanding laws and patients' rights, laboratory testing, reading and results of documenting, how to properly dispose of biohazards, finding a vein, how to react in an emergency situation. And even some of us are still currently studying for the certification. We also practice on injections on oranges and hot dogs to improve our technique. Even though small, we had a great group of instructors that saw through everything we need to do to learn to become successful. This spring, we had the pleasure of breaking in a new instructor. She was a graduate of our same program. What did that mean for us? Finally, somebody that understood our pain, our struggles, and our fatigue. Miss Knopfsinger, the blessing in disguise we all truly needed to survive Med 150. We learned that we needed to be successful in one of the hardest courses was that from her. Her laugh was contagious. Her dedication to us will always be appreciated. One of our constants through the medical assisting program has been Mrs. Greer. She has been with us since day one with one goal in mind, to teach us how to be professional, dependable. Although we tested her patience and at times, more than often, forced the death stare upon us, she always wanted us to be successful. We needed that type of instruction, as we are a reflection of the medical assisting program and profession. She set us up for the future, and now we can appreciate the method behind the madness. We all come from different backgrounds. We are all different ages. We're all different stages in life. However, none of that mattered to Mrs. Greer. We complained a lot. We fought back a lot. Some of us wrote unprofessional emails. Some of us had judgy eyes. Some of us had horrible handwriting. Some of us showed up late for class. We also had piercings and tattoos, and we were reluctant to cover them. Some of us showed up with nails and colored hair. Some of us spoke with hands. And most of us challenged assignment grading. But after all, she never gave up on us and the expectations she had for us, and I will always carry that with her. And of course, we will always be her favorite class. I can personally attest that there was many times I felt like giving up. When we decided to pursue the program, we all knew there'd be challenges. Many of us are moms, wives, employees, sisters, daughters, caretakers. Trying to maintain a balance between those personal responsibilities and school can be draining. I'm sure we all wondered if quitting would be lighten the load and stress, but thankfully we had our kids, our family members, our friends, and our instructors that cheered us on and gave us words of wisdom to keep us going. But most importantly, we had each other. While the pandemic may have changed what college looked like for us, it didn't. In fact, we earned a college diploma in medical assisting. And all the perks and opportunities it brings with us, our education is forever, and no one and nothing can take that away. With all that we faced during the pandemic and the uncertainties, we are presented to us to remind us to be resilient. While in medical assisting program, the most important lesson is learned that we are the bridges of communication between the providers and the patients. We have personally seen how patients really need not just people who can speak their language, but people who can read their expressions and body language. It's not just explaining medical terminology. It's about helping patients with their needs, and we need to get the most out of the community by finding every little bit about the person. The provider does not have time for that. We are the ones that they first meet and the ones that see them goodbye. As medical assistants, you should always keep the following motivations in your mind. Let our passions shine with all that we do and impact someone's life for better. And also, let us always be there in someone else's shoes, feel the pain down in our heart, and stretch out our hands to help. So I leave you with this: always do your best, but remember, on the day that you do make a mistake, be unwise in a decision or falter in self-control. Please forgive yourself often, deeply, and learn how to be wonderful medical assistants the healthcare world so desperately needs.
Congratulations again, graduates. Will the medical assisting graduates please come forward? Ready? Susan Nicole Bell. Rachel Cogan. LaKendra Alize Farmer. Harley Lancaster. Patresse Sanders. Erika Michelle Vaughan. Will the practical nursing graduates please come forward? Guadalupe Ailman. Olivia Michelle Edwards. Tamitha Cherise Hedgepeth. Kelsey Kasmerick. Rachel Amal Marie Medlin. Shelley Robinson.
I believe in the principles and purposes of professional medical assistant. I endeavor to be more effective. I aspire to render great service. I protect the confidence entrusted to me. I am dedicated to the care and well-being of all people. I am loyal to my employer. I am true to the ethics of my profession. I am strengthened by compassion, courage, and faith. Solemnly pledge to practice my profession faithfully. I will not knowingly administer any harmful drug or treatment. I will do all in my power to elevate the standards of my profession, and I will hold in confidence all personal matters committed to my keeping. I will honor each individual under my care with the knowledge that they are body, mind, and spirit beings. I will be an advocate and a healer. I will work to promote wellness in individuals, families, and communities. I commit myself to evidence-based practice and the ongoing pursuit of knowledge.
Okay, I know we can get louder than that. How about one more big round of applause for these great graduates? All right. All right, if y'all will please rise for the benediction, and once it's done, if you'll stand in place as the graduates and the stage guests recede. As we go forth from this place, we ask that these new angels of mercy be supported and guided as they begin their careers, as well as throughout the rest of their lives of service. We applaud their heroism as they go forth to do their vital work in this time of great need. We ask that they be given strength as they help others, and let the good they do echo throughout this world and into the next. Amen.